Good morning, everybody. Thank you for joining me today. My name is Manal Ibrahim. Today we're going to be talking a little bit about accelerated aligner therapy, precision taken to the next level. Before we get started, I just want everybody to know that there's a chance to send me some messages down on the bottom of your screen. I will do my very best to answer as many of them as I can within the time that we've got, either during or after the presentation. Some of you may have seen my quote on the Accellident website, and I just want to let you know I've been using Accellident for about 3 years, and I've been an Invisalign provider for over 10 years. And I'm so passionate about what I'm about to discuss with you all today because I feel that Accellident has truly allowed me to do things for my patients with clear aligners that I know I couldn't get done before. And it's really made me become obsessed with orthodontics right now. It's changed the way I practice and my entire practice. It's changed the dynamics and fluidity of the office and the mood and the entire experience between my staff and my patients and myself. Today, I want to share my experiences with you in my practice. I don't work for Accellident. I don't work for Invisalign, and I'm so grateful that Accellident asked me to speak to you today. They did not give me speaking points, so they are allowing me to present my experiences that I've had in my own practice. I am a practicing orthodontist outside of Chicago, Illinois. I have 2 locations, one in Naperville, one in Shorewood, 2 suburbs, and I'm also a prosthodontist. I did practice prosthodontics for about 10 years, fell in love with the idea of doing ortho-pros, went to school to become an orthodontist, and of course, you know what happens when you learn ortho. You fall in love with it, and you decide that's what you want to do. So that's what I'm doing right now. I did most of my educational training at the University of Illinois College of Dentistry here in Chicago, where I did bioengineering, then got my dental degree, and then I finished my prosthodontic certificate. I also taught there for a while, and then I started practicing prosthodontics, and I did that before deciding to go back to school. I went to NYU for ortho. It was a great experience because it was a clinically focused training program, so I learned a lot of different techniques from so many different teachers. I have 2 amazing associates, Dr. Jin and Dr. Adri. We do have an incredible time practicing together, and we help each other. We oversee all the patients' treatments, so we're able to see each other's cases and work together side by side all the time. I also practice with my husband, Anthony Lavaca. He's also a prosthodontist. That's actually how we met. We have 3 practices under one roof providing specialty services for patients of all ages. And it's been really fun putting this together, and I believe that we are able to provide just outstanding treatment by offering it under one roof. We quickly realized after we opened our practices that not only is the world changing so quickly, but the practice of dentistry is too. And I think some of us get to a point where we realize, gosh, I'm still doing the same things that I was doing when I finished ortho school. I'm still using the same techniques, the same products, and maybe I need to learn a little bit about what's out there and start advancing myself. And so with so much technology at the palm of our hands, we really have to start thinking outside the box and realizing that there's a huge evolution going on right now, as you know, with technology, not just in the world, but in orthodontics. And we really need to realize that we have to jump on that technology train, because if we don't, we're literally going to be left in the dust. So that's kind of what I have been doing, is trying to engage in all the technology that I can for the enhancement of my patients, my outcomes. It is an investment, but it does benefit your patients, and at the end of the day, it will benefit your practice. There's a lot that goes into, treating our patients, and we have to treat our patients not only better from our perspective, but better from their perspective and their eyes. And what they want is they want to be treated faster. And we all know this. Every day our patients come in and they want it done yesterday. They all have a need and a want to be done in a much shorter period of time than we feel that we can even offer them. They also want to be treated more comfortably. And I think that's what really intrigued me about using Excelident is I used to jokingly say, gosh, you know, I wish I had this little gadget that I could give you that could make your treatment go in the snap of a finger and you'd be done. And voila, of course, here comes Excelident. I wish I came up with it first, but predictability is the key here, and that's why I absolutely love Excelident, coupled with just our digital treatment planning that's at our fingertips these days. I think that, you know, the idea of sitting down and creating a digital model, whether you're doing Invisalign or SureSmile, I think it's all the same in terms of virtual treatment planning, knowing exactly where you are, where you're going, how you're going to get there, and then ordering or creating those custom aligners with Invisalign or your custom wires with SureSmile. And then it's literally execution of your treatment plan. So this type of treatment definitely reduces your stress level, and it becomes an incredible way to practice. And again, that's one of the reasons why I'm just so excited about what we do today in my office with Invisalign and with Excelident. The goal of this session today for me, and I hope to accomplish this with you, is to really show you how Excelident is a game changer in my practice, and with my team having the confidence to know that if I use Excelident, I can offer my patients the same or honestly better results with Invisalign than I can with the way that I used to do braces treatment. Using Excelident, I can give that patient what they want, which is more efficient patient care. And most importantly for me, I can not only meet my expectations of the outcome, but I can and do on a daily basis meet and exceed the patient's expectations. And that is really important. We cannot forget that. We want a raving fan. Every patient that we treat, we want them to be a raving fan. And I think meeting their expectations is key to creating raving fans that actually enhance our practice in the long term. I did go through a pretty big journey that led me to this point, and I do want to let you know that at this point everybody in my practice is offered Invisalign. I'm probably treating close to 80% of all new patients with Invisalign, if not more than that. And the patients that do end up getting braces, it's a decision that possibly the parent makes or the patient makes. It is not typically a decision that I'm going to make for them. And I do bundle Excelident with Invisalign, and what that means is that if I offer a patient Invisalign, they have to use Excelident. And if they don't, I would rather not treat that patient, of course, depending on the severity of the case, but most of the time I'd rather not treat them than even go through treating them without Excelident. And again, I took a journey to get to this point. I started doing Invisalign back at NYU. I actually taught it before I got even my certificate. I got my certificate in 2004, and in 2006, I had a great rep that actually works for Excelident right now, who really encouraged me to jump on to Invisalign and really start treating some cases. I was super excited to do 23 patient records in one evening, and from there I actually started to increase and ramp up my Invisalign in my practice. So for the course of maybe 7-8 years, I started treating more and more patients with Invisalign, and I don't know about you, but I started to get frustrated with myself and with what I was or wasn't able to do, and meaning that unless it was extremely simple and super straightforward, I was not getting the great results that I saw on my ClinChecks. I wasn't getting teeth to track. It was very difficult to keep patients motivated. Compliance was always an issue. I found myself doing multiple refinements for patients. And at the end of their treatment, I would look at their outcome and say, gosh, you know, I guess this is the best that I could do. Even after several refinements, I still did not feel that I was really giving them what I really wanted to give them. So I don't know, I started to get frustrated, and my reps would always say, hey, you should do more, you should treat different cases, and at that point I was only doing alignment. I wasn't doing anything out of the ordinary complex, I would call it. I started going to the Excellident lectures. I went to my first one in 2013. I thought, hey, this is kind of interesting. They have a lot of data to back up what they're claiming. There are a lot of doctors with testimonials at this point saying that they've got great experience in their office using Excellident with Invisalign. So I thought, hey, you know what? I'm going to give this a try. I started marketing myself as the accelerated Invisalign provider, and we really jumped on board and started doing more and more accelerated Invisalign treatments. I actually almost doubled my Invisalign cases that I treated over the next year. And we actually became a top 1% provider that year. So of course my staff now, we're super excited. We're using Excellident. We're getting great tracking. We're not having compliance issues. Everybody's excited. The patients are loving it from a comfort standpoint, changing their aligners at 1 week. So everybody was super pumped up. We ended up going to the Invisalign Summit that year, and I saw all these different types of treatments that were being treated by these amazing presenters at the summit. They were showing class 2 cases, class 3 cases, severe crowding, patients with cross bites, patients needing distalization, all these treatments that I never even attempted to do. And I thought, hey, you know, now that I'm getting great tracking with these very simple, straightforward cases, I'm going to give this a try. We were, again, really pumped up, and we went back and we started marketing ourselves pretty heavily as the orthodontist that can really treat anything. And it was a game changer, again, in my practice. And so the big question for me was, can I offer braces patients Invisalign? Can I do this and still give them the same or better outcomes? Meaning now I'm going to start pushing that envelope. And I started treating different types of patients, and I'm going to go through this with you so that you can see some of the different things that I've treated. I'm going to go through a section that I call my tooth twins. I kind of looked at some patients that I treated with braces versus Invisalign who had a very similar initial presentation. And I'm going to kind of go through with you the outcomes that they got. And of course, we'll notice a difference in treatment times as well. I wouldn't call this really, really difficult movement, but there certainly are issues here. We've got an edge-to-edge occlusion. We've got the open bite tendency. The central's roots are divergent, and those are all things that we know are going to be things that we have to absolutely control with our treatment. So here we go. Nick got braces, and of course, exactly what happens when you put braces on an open bite case, the bite opens. Now we're closing spaces, adjusting midlines, coordinating the arches, and bam, this is his picture taken the day we took braces off. And let's compare Nick with his tooth twin, Andrew, who had a very similar initial presentation. As you can see, he has a fixed retainer because he did have orthodontics before and came to me for a retreat. Andrew got Excellident with his Invisalign, and we went through, and when we got to this point, this was his finish after his first set of trays. We got a few more aligners to really perfect everything, and this was his finished case. It took us about 16 months to treat Andrew versus double that treatment time with braces for the same exact type of treatment. So I saw this and thought, wow, okay, this is pretty convincing. 16 months versus 30. Compliance was not an issue. Teeth tracked, although I did have some attachments and things like that that I watched very carefully in order to upright those roots on Andrews Centrals. We got excellent tracking, and I was really, really thrilled with what we got. So then I said, okay, I saw all these people present class 3, class 2 patients. Let me see what I can do with a pseudo type of class 3 patient where we have a challenge. And you can see these tooth twins. We've got Lauren, who actually went through Invisalign without Excelodent, and Christian, who's a lot older than she is and also has more of a underlying skeletal discrepancy. He also has the smaller laterals, which makes his treatment a lot more challenging than hers because we've got some maxillary deficiency of the teeth and we have a crossbite on the left side. So we put Lauren into Invisalign, and at this point she had finished all her aligners, but we weren't really thrilled with her end result. I wanted to do a little bit more bite closure and coordinate the arches more, so we did some refinement, and this is how she ended her treatment. Pretty close to the predicted final outcome that we saw in her ClinCheck. If you compare Christian to her, again, a little more complex, much more difficult. Christian went into treatment with his Invisalign and his Excelodent, and he got to this point when he finished all his aligners. Now, I could have told him, hey, you look pretty okay, we need to let the bite settle, but we wanted to really get rid of those initial points of contacts in the anterior and make it a much better outcome for him. So we went into some refinement aligners, and he ended up having 44 total aligners with a 12-month treatment time and got incredibly close to his predicted final outcome. I do want to also point out that I recognize he's got an open bite on the right side here, and these are some of the things that we have to really predict before we even get into treatment is if somebody's older and they have a slight skeletal discrepancy or a severe malocclusion, we want to tell them that some of the teeth that experienced previous wear may need a crown, may need a build-up, and things like that. So prediction is extremely important. But man, I was thrilled to see his final outcome so close to his predicted outcome in his ClinCheck. And then when I saw the difference in treatment time, I was pretty amazed. He had double the aligners and only 1 year of treatment with refinement, with Excelodent, with a skeletal discrepancy, with a more challenging case. So I was extremely thrilled, and Christian was just so happy. He gave me a great video testimonial and a raving fan. Another pseudo class 3 patient, Steve, he's got more of a dental class 3, bimaxillary protrusive, and some spacing in the lower arch. We really need to coordinate the midlines and coordinate the arches. He did not have any refinement with only 8 months of treatment time and 26 aligners. And when I saw this, I thought, okay, this is pretty fantastic. I don't expect to do no refinement. Even if I do refinement, it's only maybe 8 aligners to coordinate things. And Steve got no refinement at all. So he looked fantastic when I saw him at the end. And I was just thrilled, thrilled, thrilled with his final outcome. And I saw this and thought, okay, this is pretty cool. I'm going to start doing all these types of patients with my accelerated Invisalign, because if I can get this great timing, great compliance, great hygiene, great patient comfort, great patient satisfaction with predictability of tracking, this is the way to go. Next, I want you to meet my friend Priscilla, just a fantastic woman. Really hated her lower lip, the way it looks in profile. Of course, functionally, speech-wise, was very displeased with her malocclusion and had been told she needed jaw surgery her whole life. When we talked a little bit, I said, you know, I don't know if it's your jaws. I think it might just be your teeth. I was able to get her in a edge-to-edge occlusion and centric relation. And I said, you know what, let's give this a try. I don't think you're going to need jaw surgery. Let's do some Invisalign with Excelident and let's see what happens. So just as I guessed, 5 trays later, she had already disarticulated and gone to her edge-to-edge position. And of course, you can imagine how thrilled she was, extremely motivated, very compliant and diligent with her Excelident and her Invisalign, and her teeth tracked like a dream. At this point, she had finished her aligners 7 months later, and we did some refinement just to coordinate the arches and close the bite and retract those lower incisors a little bit more. And 12 months later, all in all, this was how she turned out. Of course, her initial looked worse than it was because she had a complete bilateral posterior crossbite and an anterior crossbite. But boy, I mean, I was just thrilled for her. And the biggest thing for me was her goal was to go to Florida and surprise her girls with her brand new smile for Christmas. And we were able to accomplish it for her before Christmas and was able to surprise them. And I was just thrilled for Priscilla. I was also really thrilled when I saw how incredible her outcome matches her predicted final outcome in her ClinCheck. I don't know about you, but I feel that sometimes that cartoon doesn't really get expressed in the patient's mouth. And this is, again, where I find the benefit of Excelident. It helps get all those program movements expressed so predictably. Teeth track phenomenally. And more and more often now, I am seeing nearly 100% where they're supposed to be every time they come in. I'm just amazed, and I say, oh my gosh, you look exactly the way this cartoon predicted. I know that did not happen before I started using Excelident, and I certainly would have never imagined doing these kinds of cases with Invisalign. So again, this is all the evidence to me that Excelident was working great in my practice for my patients. So again, I had seen all these different lectures talking about class 2, class 3 changes. So I decided to take another peek at my tooth twins, Nicholas and Zach, who both presented with a class 2 malocclusion, little bit of a prognathic maxilla, severe overjet, and Nick was treated with braces and appendix, which I don't use headgear in my practice, so I didn't have any other way of distalizing without using braces. So I used Invisalign on Zach. Let's take a look at these two. So Nicholas had the Pendex and the braces. I always use a lower lingual when I'm using the Pendex to counteract the negative forces of protrusion on the maxillary anteriors. I just have them run some class 2 elastics. Of course, I would never in a million years use this appliance today. This is before I dared to use Invisalign for something like this. So we were able to successfully distalize. We still needed a little bit more coordination. So we expanded his arch and got a pretty decent finish for Mr. Nick. This was several years ago at 2.5 years of treatment versus our buddy Zach, who was lucky enough to be offered accelerated Invisalign. Zach had the same type of overjet, same class 2 malocclusion, and we wanted to distalize on him. And one of the things I learned about distalization that scared me, to be honest, I wouldn't have done it without Excelident, is the fact that when you're distalizing with aligners, you're taking either 2 teeth at a time, 1 tooth at a time, however you prefer, and you're distalizing. I typically do 6, 7 first and create a big space between the 6 and the 5, and then I distalize the 4 and 5, creating spaces distal to the 3s, and then I distalize 3 to 3. So if I am not getting the exact distalization that the cartoon animation predicted, there will be more plastic between the teeth and the aligner than in the patient's mouth. So there would be no way that those aligners would fit. And again, this is where Excellident is so phenomenal because the teeth track, so you can predictably offer this to patients and have no concern that this is not going to work. Here is Zach, and again, the proof is right there. You could see the great spaces that he got that were identical to where the ClinCheck predicted. I honestly couldn't believe that after almost 10 months, Zach was pretty much done. He didn't need any refinement. He only had 36 aligners and he was done. And if you look at his x-ray, one of the things that I was kind of worried about was the wisdom teeth, but because they were so small, we'd have to be concerned about extracting them. And I was happy to see that my final x-ray showed virtually no change to the third molars. So the other thing is how incredibly close, once again, he was to the predicted finished result that the ClinCheck predicted. And again, I owe 100% of this to using Excellident with Invisalign and how compliant my patient was with both of those as well as Class 2 elastics. So I thought, hey, this worked pretty well for Zach. It cut his treatment time down from 30 months for poor Nick with braces and appendix to only 10 months with accelerated Invisalign. I thought, you know what, I'm ready to try this on an adult. And here comes my awesome patient. She walked in, drove all the way from Chicago because she saw my ads that I do accelerated Invisalign. I was concerned. She's much older than Zach. She has a much more significant, what I would call a double D bite. She had, I apologize, she has a Class 2 skeletal and dental, and I decided to go ahead and try what I tried on Zach, and I was hoping that we would get a phenomenal outcome. Because she had her left third molar, I asked her to have it extracted, but I was worried about how that would impact my outcome because I'm distalizing on one side against a French extraction site, and on the other side, I had no wisdom tooth, so no fresh extraction site. I was thrilled when she came back and I saw no difference in the distalization. So I was happy about that, but you can again see the spaces that she was getting. And this was working because she was using Excellident and Invisalign like a dream with her Class 2 elastics. At this point, she had only 6 months of treatment, 56 aligners, and she was done. She got a phenomenal result. You can imagine how thrilled she was. She did Facebook videos. She gave me a 5-star review. I mean, this lady was just the biggest raving fan. She finished so quickly and she got a beautiful outcome, and I was absolutely thrilled. And I learned from this that I can do this on adults, predictably distalize. I do need to extract third molars, and I will get no change between fresh extraction site and no extraction site on this type of patient. When I looked at her predicted outcome compared to her actual outcome, the only discrepancy I see is that her anterior overbite is slightly deeper than her predicted overbite. And I will do this all day long if that is the only thing that I end up with. I started to then think about other types of patients that came to me and really started to push that envelope, again, with Invisalign using Excellident. And I compared 2 patients, our tooth twins, Abby and Leo. They both have a blacked out canine. Of course, I look at Leo and think he's got many more challenging issues. He's got a maxillary midline deviation to the right, mandibular to the left. He's got much more significant crowding and, you know, seems a lot more challenging to me. I treated Abby years ago without Excellident and went through many trays, and she got refinement, and at the end of the day, it took us 37 months with 49 aligners, difficulty tracking, difficulty with the crowding, difficulty with the crossbite correction. And although I think she got a really decent outcome, when you look at how we treated Leo, I think you'll agree it's pretty amazing. We can manage these blocked out canines so beautifully with accelerated Invisalign. I did not distalize on Leo because he did not have his maxillary second molars erupted yet, and I don't want to impact them. So my initial aligners only created an ideal midline situation and created space for my canine to come into the mouth. If you look at his progress photos, you can see that we are slowly moving the midlines, aligning them. We're not distalizing, and we've created a great space for that canine to come in. We're using some auxiliaries to close that canine bite down and create a better intercuspation with the lower teeth. And this is his progress at 6 months. I can't believe that we were able to accomplish this at 6 months. And if you look at him, I'm just honestly blown away that we could do all of this for Leo with Invisalign, with Excelident, and get such a great result for him without needing to do braces or extractions. I absolutely thought I was going to need to distalize on Leo, and as it turned out, he ended up in a pretty good class 1 molar occlusion. So at this point, we are just waiting for his second molars to erupt. At 6 months of treatment, we'll do a quick scan, get maybe 8 aligners, probably with no attachments, coordinate all the molars, tuck in that upper right canine, and he's literally done in 8 months of treatment compared to Abby, no Excelident, very similar treatment, and 36 months for her. Another very similar patient, just like the previous one, with the impacted maxillary left canine. I need to distalize on that left side. He does have an issue with his second molars, so we requested extraction of the third molars so that I could predictably distalize and make space for that canine. The other challenge for Brendan was that I had to really intrude those lower incisors significantly to level out his curve of spee. So I had to really hope that I could get this predicted result for him and level out that curve of spee, which was really important. So progress shows that we got a great amount of space. We were able to get that canine in and get him a beautiful result with only 56 aligners. He did have 1 refinement. He had 15 months of treatment, but I'll be honest, some of those months were holding months, waiting for him to get the wisdom tooth extracted for distalizing and waiting for his second molar to erupt and things like that. So some of that treatment time wasn't actually treatment. And if you look at his predicted outcome, I believe he got just a fantastic result compared to his predicted outcome, especially the predicted outcome of where that canine is going to be. And we're holding him here for a little bit, and then we're going to scan him and get just some 8 aligners to get that midline right on, and he is done. Another incredible tooth twin case I want to share with you is looking at spacing. And at this point in my practice, I'm actually only doing SureSmile. I'm not treating any patient without SureSmile because I believe so much in virtual treatment planning and getting those customized wires or customized aligners. So Jessica was planned for braces. She's not doing Excelident, but she is doing SureSmile. And so we do expect her treatment time to be much quicker than any patient going through regular braces treatment. And if you look at her, she's bimaxillary protrusive. She's got significant spacing, edge-to-edge overbite, edge-to-edge overjet. And at this progress record was taken. It was her, so she is still a progress patient for me, and I will be sharing some of those with you because I think it's important to show not just finished cases, but sort of works in progress. Jessica, at this point, was getting her SureSmile record, so phenomenal result before even going into SureSmile. She has 2 months of treatment left. That is it. Versus Tianka, who went into Invisalign. She has the same kind of spacing to close. September, you could see that she's closed so much of that spacing, and we've gotten a great result at this progress picture to be able to finish her in only 5 months with our accelerated Invisalign. I think that is a mind blower. To me, I was just blown away when I saw that. And I 100% attribute that to her Excelident use. Compliance with Excelident was absolutely a must. And if you think about Jessica at 10 months of treatment with SureSmile versus half the treatment time with our accelerated Invisalign. So I just love, and I think you'll agree, what an awesome outcome. One of the things that I also learned about using Invisalign is that it is really important for patients like Tianka who have a significant amount of spacing to track. If these teeth are not 100% tracking in those aligners, the trays will not fit. And before I used Excelident, I would either have patients wear the trays for 3 weeks each, or I would constantly be having to backtrack because the teeth just simply weren't tracking in the aligners. And so sometimes today, even with Excelident, depending on the significance of the spacing, I may actually switch them from 7-day aligner change with Excelident to 10-day aligner, but I think that's still phenomenal. So this is another work in progress, and I thought this was really risky, but it was an amazing outcome, and I wanted to share with you how I managed an exposure patient. My tooth twins, Emily, who got Invisalign with Excelident, versus Sean, who got braces without Excelident. They both had impacted canines. Sean's one was on the palate, but the one on the right circled here was extremely similar to Miss Emily's. Of course, the one on the palate had the typical surgical exposure, and the one on the buccal had this type of exposure, which we see all the time with surgical exposure, and we tie them and we bring them into the arch. Emily was able to do something a little bit different. With her, we were able to, and you could see the level of canines, how high they really are, which is hard to appreciate from her clinical photos. Emily had exposure of her canines using a little bit of a different approach. We used a soft tissue laser, and then we did some alveoplasty, just scoring the bone to expose the canines. This picture was taken literally a week after Emily got her exposures, and I want to show you how I managed her case. If you look at that top photo, that is a week after her exposure. We bonded tooth buttons on her canines, plastic buttons on the trays, and we put those there on purpose to give her more of a horizontal and vertical vector. I didn't want pure vertical because I needed to pull those canines out and then down so that I don't run into the alveolar housing. And you could see within 3 months, those teeth were really moving down so beautifully. I was flabbergasted. A month later, those canines are in, I would call, a near perfect occlusion. And what's interesting to point out is that in these types of cases, she's using Excelident, but the teeth are actually moving so much faster than the ClinCheck predicts. So the trays were actually holding her up. You could see here that I had to cut out the canines and let them loose. I know it's uncontrolled tooth movement, which I don't like, so I was seeing her pretty frequently, and she happens to be my neighbor, but we were able to move those teeth down so quickly without the aligners holding them up. Here's a series of pictures without the aligners in place so that you can see what this transition looked like. So remember, those canines, the incisal edge of those canines were above the CEJ of those centrals, so they were here somewhere. The first picture, 6-7, was a week after. That's when we started bringing them down, and then on 10, 11, just a month later, you could see that her canines were in a perfect position. So what we did at that point is we did refinement records, and I will literally get 10 aligners, attachments only on the maxillary canines to lock them into position so that they don't move up again. And she is done, and done. I mean, I can't believe this, but I know that using Excelident, I can get these exposed teeth down in a heartbeat. Any tooth that is really high, I'm amazed at how quickly they emerge into the mouth when the patient is using Excelident. It's amazing to me. And the other thing was, look at how close she ended up to her projected finish. Even where the canines and premolars ended up, those were all not even erupted when we did her initial scan. They predicted where they would be, and they created hollow pontics for them to emerge into. So I was just amazed when I saw this. And needless to say, this kind of patient is a teen. She is a cheerleader. She is a raving fan. She is just blown away that she didn't need braces. And of course, we're more blown away than they are because we understand the complexity. And when you compare her with poor Sean, who at this progress point was 28 months into treatment, versus Emily, who's 11 months, and she'll be done in literally 8 or 10 weeks. So I just think that's pretty phenomenal, and I think you'll agree. So just to kind of recap, again, with impactions, you're going to get a lot quicker movement, eruption of those impacted, exposed types of teeth. I see second molars erupting quicker. I see premolars coming into the arch quicker. I've actually seen teeth that the oral surgeon and I agreed were impacted come into the mouth unexpectedly. So that was a big shocker. But with impactions, you need to recognize there is a race between the soft and hard tissue healing over the exposed tooth versus the tooth moving into the arch. And we all know this because with exposures, oftentimes we have to have a revision to the exposure because the tissue healed quicker than we were able to get the tooth in. But with Excelident, what my clinical experience shows me is that the teeth move so much more predictably and rapidly that these revisions are just no longer needed in my practice. A couple more mind-blowing cases that I want to show you, and these again are works in progress. So keep in mind, these are still not finished treatments. But again, talk about something that I would have never in a million years thought about treating with Invisalign. I would look at this patient and say, okay, Andrea, you're such a beautiful girl. You've got unbelievable crowding. You've got that blocked out premolar laying down. You've got a really rotated lateral. I think you might need extractions. I don't know. But I look at her today and I go, okay, done. 1 year accelerated Invisalign and you're done. And so this is the kind of thing that I have now predictably treated with in my practice. And I am so confident that I will get a phenomenal outcome because I'm using Excelident with Invisalign. The two big challenges for me is that lateral, because as you all know, laterals just simply have a hard time tracking in the aligners. And of course, that premolar, it's so blocked out that we have to really think really well when we're doing our ClinCheck on the mechanics of tooth movement, the direction of tooth movement, and also what kind of mechanics and auxiliaries we're going to have to use. And I'm telling you, if you're questioning, will Invisalign work for this? I'm telling you right now, it will. And you know what I'm going to say next. With Excelident, it will work. So this is Andrea, and just to mention, she is an extremely exacting patient, and I am okay with that, but she's asking a million questions, using her magnifying glass, looking at every single thing I'm doing. So she comes in and we have these progress records, which in my office we take them every 3 months, and I'm pretty excited. I mean, I'm getting some great coordination and I'm getting some alignment. The lower anteriors are almost right on the money. And yes, we are using a lot of auxiliaries because what I've learned is that we are orthodontists. We have to think about an orthodontic treatment as what do I need to do to align the teeth, and what do I need to do to coordinate the arches? If we expect braces or aligners to do this work for us without us putting in the thought, we're going to fail all the way. Whatever we need to do with braces to coordinate teeth and make them do what we want them to do is the same way we have to approach aligner cases. We're not going to let the aligners do the work for us. We're not going to send our case in and let Invisalign do it. We have to use Invisalign to do it for the patient. So a lot of thought has to be put into these workups and these ClinChecks and planning out mechanics of tooth movement. At this point, I look at Andrea and I think, if I erased the button and all the attachments, I would say she is pretty close to the finish line. And at 7 months of treatment, you can see that her progress photos at 7 months are actually almost identical to her predicted outcome. I don't know about you folks, but I think this is mind-blowing when I see it. And all Andrea needs is at this point is literally maybe 8 or 12 aligners, possibly no attachments, just to do some final finessing, final coordinating, and get those teeth in perfect position. Needless to say, she is one raving fan. And just so that we recap about severe crowding, again, why Excelident is so important is the tracking here doesn't only involve correcting that crossbite, but there are so many moving parts when you have a crossbite. You've lost space, you've lost arch length and arch distance, you've got over-erupted teeth, and most of the time some severely crowded teeth. So keeping all these moving parts moving properly is really, really important. This gal could almost be Andrea's tooth twin, except she also got Invisalign with Excelident, and I call her another mind blower because if you look, she is another one of those that's got that severe crossbite, bilateral posterior crossbite, severe crowding. And if you think to yourself, will Invisalign work? Look at all this rotation. Look at all this root movement. I'm here to tell you, yes, it will. If you look at Moret at just several months into progress, I think you can agree that with some creative mechanics of tooth movement, she is looking phenomenal at this point. I also want you to know that at this point, she's looking even better. We're using elastics. She's compliant with her Excelident. She's doing a great job with everything. And I focused more here on leveling the arches and aligning the teeth and eliminating the crossbites. And the coordination of the arches, namely her class 2 correction on that left side, has not been put as a priority because I recognize that if I try to do class 2 correction on the left and alignment with crossbite correction on the left, I'm not going to succeed. I'm going to collapse the arch again. So in the last 12 months, she got a phenomenal result. If you look at her alignment, she had great alignment, but we're still needing to do some coordination. So 12 months of treatment, we're going to do probably around 4 more months of refinement with some good class 2 elastics, and she will be a happy camper. No braces, no extractions, and a really good result so far. Again, just to recap what we talked about, with crossbites, Invisalign is so great because you get immediate disarticulation of the arches through the plastic thickness. You get that bite opening. You're able to intrude all the over-erupted teeth required to get rid of the bites. You're able to develop the arches to fit that tooth in and expand. And again, tracking is just 100% the key to the success here. And again, just to recap how close she is to that predicted final outcome. I recognize that lower left premolar isn't perfect yet, but if you look at it, it's not that far off. We just need to bring it a little bit buccal and we are good to go. So if you remember, I kind of threw out a question at the very beginning that was really to myself, going through these tooth twins, going through all these different things. And my question was to you, and myself really, can we offer the same outcomes or better to our patients with all degrees of complexity with Invisalign as we do braces? And I really hope that you are answering yes, just like I'm answering yes. I really hope that you have seen some of the things that I do, and I'm here to tell you I am not an expert at this. I have learned through my failures. I have started to think more like an orthodontist, using a product and not letting the product do the work. And through the use of Excelident, I have been able to predictably give my patients the results that they need. So in conclusion, I hope that we were able to really accomplish our big overall goal of this session. I really hope that I showed you how Excelident is my game changer, because now I can offer Invisalign to everybody and I can get better results, better than I could with braces, more efficiently and more expeditiously, and absolutely create raving fans, because I am meeting and exceeding their wildest expectations. I'm actually exceeding my own expectations at this point. So I want to just thank you a million for spending this time with me today. I hope that we were able to share some great pearls, and I wish you all a wonderful weekend. We've got a few more minutes remaining, so I am happy to entertain some questions at this point, and I'm going to start looking through some of the questions on the bottom. Bear with me as I try to pull them up. I have a question about how has Invisalign's change in aligner week from 2 weeks to 1 week influencing your decision for Excelident use in your patients? Do you think, let me first answer that question. I think that what the statement, and of course you can refer to Invisalign and have them answer your question, but we all just saw that the rate of tooth movement and tracking of the teeth is so extremely important in your expected outcome. And if you don't get tracking the teeth, you will not achieve your predicted final outcome. And so I think you have to be really careful where you're decreasing or increasing the number of days with aligners to get the outcome that you have promised the patients. And I am telling you, I don't treat patients without Excelident, and with Excelident, I still can vary the number of days per aligner. So thank you so much for that question. Trying to get some of the questions here. Anybody else have a question coming for me? There's a question regarding Marek, and it says, did the elastics connect? Where did the elastics connect on the left side? So the crossbite elastics were to lingual buttons, and that's how she connected the elastics. I now do derotation using buttons on the teeth. I have had very little luck getting teeth to derotate really to the level that we expect it to using attachments and aligners. So I no longer rely on my attachments. I will do button cutouts to derotate teeth just like you would braces patients. If you have a rotated premolar, you're using, let's say, the brackets on the buccal, and you're using lingual buttons and you're power chaining to derotate. So that's at this point how I am derotating premolars. Again, those teeth will derotate a lot quicker than your aligners predict. So oftentimes you have to actually remove the teeth from the aligner and let them derotate. Anybody else have any questions for me? I do have a question about expansion. With the degree of expansion and or anterior proclination in these adult patients, what are your perio observations with respect to gingival bone coverage. Thank you. That is a great question. I have noticed that many patients actually have an improvement in their perio and their gingival issues that they've been having. Many of the patients have cross bites and the teeth are literally getting pushed out of the bony housing. And that did happen with Andrea. On the left side, she had a tooth and cross bite. So once you get those teeth back into the bony housing, you can see that the gingiva improves in its position. I know we're not getting bony growth, but at least the gingiva is not getting stressed anymore, and we're able to really see a very nice change for the patient. I have a question here that says, what is your experience with posterior bite opening during treatment, and what do you do to prevent it? And this is kind of one of those debates that actually goes back and forth between doctors, users, and with Invisalign. Invisalign will tell you that the thickness of the plastic does not contribute to posterior bite opening. And I will tell you that posterior bite opening can be caused by a multitude of things and in varying degrees of severity. I see extremely minimal posterior bite opening in brachyfacial patients that I don't worry about, because I track these patients, and when they start going to nighttime retention wear, their bite closes beautifully. I do occlusal adjustments and we have no issues. I do know that sometimes if you have interferences in the anterior area, you will have bilateral posterior bite opening, and this is where really important refinement is due for that patient. So you can eliminate the anterior interferences and get some great posterior interdigitation and get great posterior occlusion. I know that Invisalign has a lot of webinars on this on their website, so I encourage you to go ahead and take a look at those. I have a great question here asking, is there any pushback on the extra cost of Excelident? I assume it's worth it to the patient to get done faster and have less pain. And, you know, I would say the answer to that question goes back to us. If you feel it in your gut that this is something that is giving your patient phenomenal outcome of treatment and that you're giving them better than they ever expected, then you are going to know that there is value here, and your team that's presenting this is going to show the value. And once you show the value, I get absolutely zero resistance. We do break down the payments so that they pay for the Excelident during their treatment time. Yes, patients get finished quicker. We have no problem finishing patients at 6 months and letting them pay until their 15 months is done. We don't make them pay in the 6 months that we're treating them. We have had absolutely no issues with that at all. So the answer to your question is we used to get pushback until we started educating them, and we recognize that educating them goes a very long way. There's another great question. We only have 1 minute on the clock, and this is a great question. It says, have you seen an increase in Invisalign acceptance for teens by adding Excelident, which decreases the treatment time? And I would say 100% absolutely. My teens want Invisalign, and their parents want Invisalign for them. And with the education of how the teeth track and the patients are able to be much more compliant because they're only doing 1 week aligner wear, the patients love it and the parents love it, and we're getting a much higher acceptance rate. I'd say about 90% of our patients today that are teens are starting with Invisalign. And with that, I think we need to wrap it up. I appreciate all of you for spending this time together, and I wish you all a beautiful weekend. Until we meet again, I say have a great day, everybody. Thank you.